Canine Behavior Medications Used for Anxiety. Author Medina Regalia for Tarleton State University. The underlying reasons for anxiety in dogs can be varied, but these can create dangerous behaviors within the shelter. Usually dogs display their anxiety in different ways. It could either be through aggression, obsessive-compulsive activities, fearful behavior, attention-seeking behavior, as well as separation anxiety from being relinquished by their owners. Prior to prescribing any kind of behavioral modification medications, ideally the animal should have been already assessed by using a standardized method of assessing their behavior. They should also, regardless of their age, have a complete medical evaluation, which would include a blood and urine assessment to ensure there's no underlying medical issues that could be causing the behavior or conditions that might prohibit them from being able to take the medications, such as liver disease. The types of medication used for anxiety in dogs can range. There are human psychiatric agents that are not licensed by the FDA for use in companion animals. On these occasions, they should be prescribed by a veterinarian. However, there are FDA-approved drugs for use with specific behavior problems such as separation anxiety and cognitive dysfunction. The medications used for aggression that are due to anxiety, however, are typically prescribed extra-label. If you are using this off-label medication, the owner should be informed and sign a release that will list all of the risks, the limitations, and possible side effects that the drug has been given. The most commonly used anti-anxiety meds for animals are SSRIs, TCAs, and MAO inhibitors. In the next few slides, we will go over the potential side effects of all of these medications that the owner should be aware of. The AZAPIRONE class contains the medication buspirone under the brand names of Buspar or Namenspen. This is a non-sedative medication. It's used to treat generalized anxiety and is the best course of treatment with an animal that has no history of aggression. There's also no muscle relaxant effects, so it does not affect any GABA binding that is important for CNS function. In the tricyclic antidepressant class, we have amitriptyline under the brand name Elavil or clomipramine under the brand names anifranil or clomicalm. These medications work by lowering the animal's serotonin levels in the brain and are not sedative to the animal. In the benzodiazepine class, we have 3 medications to choose from. Alprazolam, also under the brand name of Xanax, clorazepate under the brand names of Transine SD or Genezine, also diazepam under the brand names of Valium, Diastat, or Vival. All of these medications will mildly sedate the animal and are very short-acting. If they are used for long-term care, sedation will lessen, but the animal's anxiety will still be eased. The ultimate goal of these medications is relaxation and just mild sedation. There's a wide dose range, so medications should be prescribed by a veterinarian. In our MAO inhibitor class, we have selegiline, also under the brand name of Anapril or Zelapar, and there are a few others. This class of drugs is approved for treatment of canine cognitive dysfunction as well as pituitary-dependent Cushing's disease. These medications are working to increase the dopamine levels in the animal's brain, and they also act as a CNS stimulant. In our serotonin antagonist-reuptake inhibitor class, we frequently use this therapy in pets that do not respond to conventional therapies. Trazodone is used to treat some behavioral disorders, specifically anxiety and phobia-related disorders in dogs. It is typically considered off-label or extra-label to treat any behavioral disorders in our canines. In the selective serotonin-reuptake inhibitor class, we have the option of 3 medications: fluoxetine under the brand name of Reconcile, paroxetine under the brand name of Paxil, and sertraline under the brand names of Zoloft or Lustrol. These are typically used for OCD-type behaviors, separation anxiety, fearful behaviors, and a few types of aggressions. These medications are very selective for serotonin, and they also lack the anticholinergic and cardiovascular side effects that TCAs hold. These medications should also not be used in conjunction with MAO inhibitors. We also have the option to use some non-pharmaceutical agents. These are especially useful when an animal is being weaned off of one drug protocol and onto the next. At these times, the owner may be seeing some problems with the behavior, so we can supplement the animal with using things like pheromone diffusers, prescription diets, supplementing their vitamins and natural compounds, and using natural amino acids to modify their behavior. Clients should be educated about the medications that their animals are currently taking for behavior modification. Because trazodone, SSRIs, TCAs, and MAO inhibitors will boost the serotonin levels, the use in combination of any of these two drugs together can potentially trigger serotonin toxicity, or what we call serotonin syndrome, which could be potentially fatal. So it is advisable to inform your client about the drug's prescriptions so they follow them precisely to avoid any dangerous overdoses or miscalculations. We should also educate our clients that this process can be slow and we will not see immediate effects for the animals. It may take 1 to 2 months to take effect. If we do not see any measurable change within a specific amount of time, we should also inform the client that it may be necessary to taper them off of one drug and discontinue that medication before beginning a new one. References used. Image references.